Okay, good morning. I'm going to make a start, if that's okay. We may have some people joining us as we go along, but hopefully we try and keep to time and maybe finish a little bit earlier. Seems though it's a small group. This is the third time we've done this orientation, and we've got a wonderful team here that are willing to be invested in your futures and think about how you think about how they can support you. So I'll do some introductions a little bit later. First, I want to do a welcome. I'm Deborah Kane, the Bachelor of Nursing, or hopefully you're in the right place because this is a Bachelor of Nursing, but it's for students who've already got a degree, so what we call the Graduate Entry Programme. Anybody in the wrong place? You're in the wrong place? Really? So what course should you be on? Are you in nursing? That's a start. Are you on a 3-year program? Part-time, but 3 years part-time? 6 years. Okay. So you're on the Bachelor of Nursing pre-registration. Okay. So it's still applicable, but there would be some topics that those who've got a degree will differ from you. Okay, so bear with me if it sometimes gets a little bit confusing. Just the one person? Oh, we've got the whole mixture today, the whole 3 programs. Oh, I'm sure Pauline's landed me in it for this one. She knew. We're going to make a start, and so I've got, first of all, I ought to introduce myself, didn't I? That's what I started out to do. I'm Deborah Kane. I'm one of the course coordinators for the Bachelor of Nursing. There's 2 of us. So there's Pauline Hill, who will be with us hopefully a little bit later, but just can't be here at this point in time. So you'll meet Pauline as well, and both of us look after the programme and see making sure students are tracking well through it, really. We have a welcome from our President, the Vice-Chancellor, Colin Sterling. So I'm going to let you see this welcome and a little bit of the introduction, which talks about the Bedford campus and what we say up the hill. But there's some wonderful resources and places for you to visit. And this one doesn't work, does it? So I think I have to go to this one.
I'd like to take this opportunity to welcome you to Flinders University. Every year it's terrific to see new faces on campus and to know that so many people have chosen to study here at Flinders. I love walking through the hub, feeling that incredible buzz and seeing students just like you, talking to new friends, sharing ideas, helping each other. These are just some of the things that make Flinders such a wonderful place to study, as I'm sure you'll discover once you find your feet. The first few days may seem a bit of a blur. We've all been there. Starting in university is a big step, and it takes time to learn all the ins and outs. But don't worry, plenty of support's available to help make your transition to life at Flinders as easy as possible. Flinders staff and student ambassadors can help you find your way. And I know from experience that your fellow students are kind, inclusive, and always ready to help. So where do you begin? Well, Flinders' website's a great starting point. You'll find campus maps, plenty of information about university life. Our Ask Flinders Facebook page will keep you up to date on university events and Flinders news. Flinders also has a busy social scene. The Flinders University Student Association, FUSA, can help you find social clubs and many other activities. As well as online support, we also provide support in person at our campus locations at Stirk, Tonsley, Victoria Square, regional South Australia, and across the Northern Territory. Here at Bedford Park, the Flinders Connect team in the hub can answer questions about enrolments and course information. The Student Learning Centre within Flinders Library is also a great resource for any academic help you might need. Our confidential and professional health, counselling and disability services are available to all students. And Flinders is this drop-in centre and warm and inviting space for people from all backgrounds to socialise. Oh, and of course, Bedford Park has plenty of food outlets although I'm sure you've discovered those for yourself already. I'm confident that you're going to love being a student here at Flinders University, and I hope you're going to have the time of your life.
Okay, let me go back to my PowerPoint from current slide. So that was Colin. Please, if you take the opportunity, if you've never been to Flinders before, have a walk over the bridge and go and see the hub. There are some wonderful food places there and lots of other resources, help services for you. So just have a wander across. It's end of the week, my voice is going. But also there's a shuttle bus as well that goes around the campus if you don't feel like getting your steps up for the day. I'd like to recognise that Flinders University was actually established on the lands of the Kaurna Nation. The Bedford Park is built on Warraparinga, and Warraparinga is a special land, and so we recognise and acknowledge the traditional owners, past and present and emerging, and recognise their continued relationship and responsibility to these lands and waters. Flinders is actually part of a reconciliation action plan, which is an Australian action plan. It's nationwide, and it's where lots of organisations come together to reduce prejudice and to empower the Aboriginal and Torres Strait Islanders and their culture and instill a sense of pride in all of us to be part of this country. Now, if you have any questions, which I'm sure you will, and going on the last 2 days, the questions we've had have mainly been around placements, which means I can take a step back, and the person to answer those will be coming in a little bit later. But if you do have any, you can put your hand up, and there will be somebody who runs around with a microphone and, gets to listen to the question, and hopefully we can answer it. But also you can use Slido. So if you actually want to submit questions, you can download this app and the password and send it through. And our wonderful lady here, Alicia, actually tells me what those questions are coming through, and again we can address them. So if you're not quite brave enough to put your hand up yet, send them through on Slido, and we'll look at them at various points throughout the morning. The app and the password are actually on most of the slides or every other slide, so if you haven't got a chance to get it down, it will come up again. So you have enrolled with the College of Nursing and Health Sciences. We're a large college. There are 6 colleges at Flinders University, and so we don't only offer nursing in the college, we have allied health professionals as well, whether it's optometry, occupational therapy, physiotherapy, disability. What else do we offer? Hearing, audiology, I think I said ophthalmy. There you go. So lots. And so you can imagine lots of students wandering around, and please introduce yourself to people as you go. Everybody's in the same predicament. They're all new, even if you've been to university before. It's a new course, it's a new area. So the only way you're going to get to know people is actually by speaking up. Some introductions. The person that I'm going to show a video of first is Professor Alison Kitson, and she is our Vice President and Executive Dean of the college, so looks after nursing and all those allied health professions I mentioned. And so listen to her welcome, and then I'll introduce you to some of the team. I'm hoping this link works.
Hello, my name is Alison Kitson, and I'm the Vice President and Executive Director of the College of Nursing and Health Sciences here at Flinders University. Now, and first of all, I'd really like to welcome everybody here. You realise that in the first 3 weeks of your time at Flinders, the people that you will meet, the 10, the 15, the 20, will become your friendship group over the next 3 or 4 or 5 years that you're going to be studying at the university. That was what happened with me all those years ago whenever I did an undergraduate degree at the University of Ulster in Northern Ireland. So in the first 3 weeks, we want you really to get to know each other, mix up, find out as much as you can about each other, because actually the time that you spend with other people, other disciplines, other groups is really going to make you the right sort of professional that you want to be, whether you're caring for people with a disability in the community, whether you work in hospital, whether you work in aged care, whether you work in any of the other industries that you will be going to once you've finished your degree with us. But not to forget about the first few weeks, the first few days, the first hours that we've been here. We want you really to enjoy it. Get in there, explore, introduce yourself, ask loads of questions, because that's what these next few weeks are all about. Settling down. Yes, the campus might look really, really big, but there's loads of friendly people, there's lots of signage, there's lots of places you can stop, have a coffee, have a drink, and talk to people. Also, don't forget that being a health professional and from the College of Nursing and Health Sciences, you will be out and about, you're going to be in clinical placements, you're going to be meeting with lots of people, so it's a really fun-packed program, whether you're a nurse, a midwife, an allied health profession. So all I just want to say is have a great time. If you see me, stop me, say hello. I'd love to hear how you're settling down, and most of all, enjoy yourself. Bye.
Okay, so moving on with the rest of our team then. So I'd like to introduce Associate Professor Suzanne Pearce. Suzanne is our academic lead in the nursing programme, and so I'm going to let her say a few words, maybe use that one, it might be easier, and then we can pass that on.
Good morning, everyone. It's wonderful to see you all. It's always a very exciting time for us to invite new students and invite future health professionals to our university. So lovely to meet you all. Every time I look into the audience, I see myself 24 years ago as a mature age student embarking on my journey of studying nursing, and I must say I have never for a minute regretted making that move. It's been an amazing career and has taken me to lots of very interesting places. So you might see yourself right now as a nurse that works in a hospital, but the world of nursing is just so big, so you just never know where you might end up. And you might end up just like us, and actually teaching other future generations of nurses. So welcome, and I lead the team, the nursing academic team, and if you see me, please feel free to have a chat. It would be lovely to meet you. So welcome.
Thanks, Suzanne. I'm going to now introduce you to Dr. Tiffany Conroy, who's our Teaching Programme Director. Here she comes. You have to do a little dance as well.
Try to keep people entertained. Welcome to nursing. You're going to have a great time. All right. It's a wonderful profession. It will take you anywhere you want to go, all over the world, as Suzanne mentioned. And we're delighted to have you here. We're particularly delighted to get when we get our graduate entry students that come in with that life experience that's so valuable in nursing. You know, that really gives you a head start, and we're really, really pleased that you've chosen to do your nursing with us here at Flinders. So enjoy. Thank you.
Thanks, Tiff. I feel like a compere, like on a cruise ship or something. Just don't expect me to sing. I've already introduced myself. So now what happens is we actually have year level coordinators as well, because we are a big programme. We take a large number of students in the university. We're the largest programme offered in the university. And I think I heard a couple of months ago that even the second largest, we're 4 times bigger than them. And so a huge amount of students. And that takes a lot of management and, you know, a lot of people to support and lots of questions to answer. So we have year level coordinators to help us out in that. Oh, was it not on? Thank you. Did you all still hear me though? Yeah, probably. My voice is big enough, isn't it? Loud enough. Okay, so Katrina Brearden is our first year level coordinator, and unfortunately she's teaching this morning, so she's unable to be here. But we have our second year level coordinator who's going to introduce herself. Yes, this time.
Hi, welcome all of you to Flinders. My name is Fatima. I'm your second year level coordinator, so if you have any problems in your second year topics, you can come and see me. And I also topic coordinate second year topics, so I will be seeing some of you.
Yes.
Yes.
I think. Oh.
All right. Thank you.
Thank you. And our third year coordinator, we have somewhere, Jodie Price.
Hi everyone, welcome to Flinders, welcome to nursing. It's exciting, isn't it? So I'm the third year coordinator, so I'll see you in your third year topics next year. Okay, so all the best for second year, see you next year. We'll come around quick enough.
Too soon. Leanne, you will get to be introduced to in a little while. She is in a meeting at the moment. But we also have some other people that's important for you to know, and that's Danelle Cross. She's going to quickly say hello, but then hopefully she'll have a bit more to say to you later in the morning.
Hi everyone, yes, I will have a quick chat to you a bit later in the morning, but welcome, it's exciting to see you. I've actually been in the same seat as a mature age student myself, so I know how you all feel. But exciting journey ahead of you, and I'll chat a bit later.
Thanks, Danelle. And I would say one of the most important people on our team is Alicia. What would we do without Alicia?
Hi guys, they're very, very kind.
Introduce your role.
My name's Alicia, I'm the Enrolment and Course Advisor here, so you'll probably see me quite a bit or have a lot to do with me. I help you from the very first topic that you enrol into right through to your very final topic when you're about to be registered nurses, which is really exciting. Because we do have a couple of different programs, it can be a little bit overwhelming to organise what topic you're enrolled into and what pathway you need to do. So please come and see me at any time if you need any assistance. We'll pop my details up later so that you can email me at any time. I'm located in the college office, which is downstairs in the courtyard. Feel free to pop in at any time and ask to see me if you need any help whatsoever with your enrolment or your study plan. I also help look after credit applications if you've done prior learning that is equivalent to what's being in your program. You can apply for that. I also look after if you are wanting to go on leave of absences, if you need to take some time off for whatever reason, we can have a chat about that and how that will impact your study. But welcome, I look forward to seeing you guys and getting to know you over the next couple of years.
Yeah, thank you, Alicia. It's really important to take on board what Alicia says, because what we would prefer you not to do is start changing things yourself in your topics and pathways, because what you inadvertently can actually occur is that you put yourself back because some topics have prerequisites or there may be progress issues. So I would advise you, if you're thinking of doing anything differently, then please speak to Alicia. You can book a meeting with her through NHS Enquiries, which is a general email that you'll get used to using, and then she can arrange a meeting by phone or face-to-face and actually discuss a pathway that's going to suit you best, that's going to meet your needs, all right? Which is why she's the important person to know. So these are just some of the topics. Now, because we've got a mixed bunch, I was going to say that the topics in the black one and the 3 green ones would be for the Bachelor of Nursing graduate entry. However, we've got a mixture of other people in the room as well. And so the graduate entry program is slightly different in that, of course, you have a 2-year program rather than a 3-year program, and we have to cater for that. So some of those first-year topics that is about getting familiar with university life and those sorts of aspects of university learning, you don't necessarily have to do. Similarly with the people who've come in with the diploma of enrolled nursing, they get credit for their first year. But let me introduce you to some of our topic coordinators. We've got 2 with us today. So I'm going to introduce you first to Jessie Anderson, who's topic coordinator for 2011. Come across, Jessie, say hello.
Hi everyone, welcome. You've probably already received an email from me if you're enrolled in 2011 this semester, so make sure you check your student emails to get all the information you need, and I look forward to meeting you all next week in proper.
Thanks, Jessie. And one of the other topic coordinators we have that probably this group won't see in the role as topic coordinator, apart from the person who's doing the 3-year degree, is Didi Button. Didi has many hats, so she's going to explain a few of what they are.
Thank you. Are we on? Yeah. Good morning, everybody. And just as Tiffany said, nursing, you can go anywhere in the world. Wherever there is people, you carry it in your head and your heart and your hands. So welcome. I'm a topic coordinator for a first-year topic that most of you won't be doing, but one of the other jobs is that I'm also the contact person for people with a disability. So the university has very strong policies for supporting students with a disability. In Australia currently there are over 70,000 students who have disabilities who are engaged in university studies. Only 5% of disabilities are physically obvious. So if you have a disability and you need support, then come and see me or go and make an appointment with Health and Counselling, and they have disability advisors up there. The other hat I wear is Equal Opportunity Contact Officer. So the university is a safe environment, it is a no bullying environment, and harassment and bullying are not tolerated. So you have if you experience any of this, you need to make contact with your tutors, with your topic coordinators. If you see any of us walking around, then you come and say hello to us, and we will support you and make sure that that is not happening. All right, so I look forward to seeing you around the campus and possibly in other topics. Bye for now.
Thanks, Didi. Just turn that off. So it can get a little bit confusing when we talk about different pathways, different availabilities. We use different language, academics, tutors, topic coordinators, year-level coordinators, course coordinators, and it all starts becoming a blur. So you are enrolled in topics. Each topic is either 4.5 units, or if it's a placement topic, there are some placement topics that are 9 units equivalent. And that just gives us a sense of what hours you need to do. So a 4.5 unit topic is usually around 135 hours of study across the duration of that topic. So this is what you need to be thinking about, is if you're full-time, doing 4 topics full-time is the equivalent of 40 hours a week. That's a full-time job. So you really need to start thinking about how you can plan your life, and we'll talk about a little bit more about that a bit later. The sequence and prerequisites. Some topics need you to have a foundation of knowledge before you can move up to the next topic. There's no point you choosing one topic which starts talking about, complex health needs if you haven't looked at the health needs that are foundational. So sometimes we say you can't move on because you need to have successfully passed this topic first, which is why I say Alicia becomes very important. When you go, in semester 2 I want to drop that one and I'll do that one. Might not be as easy as that. So please make sure you look on the course rules, which is on the university webpage. When each topic has a course rules page, has information, and will tell you exactly if there's prerequisites that you require So you can start planning that and planning the next 2 or 3 years. So we like things to go in sequence. And there's also people from the past will come and say, well, there's different availabilities. What does that mean? And that's in the past because we have had so many students, we can't offer things just once because there's too many. We actually don't have enough classrooms. So we've had to have different availabilities so that people start at different times. Now, people used to have a choice of availabilities. Unfortunately, we had to limit that because it became very confusing for them and us. So my understanding is the graduate are in one pathway now. So you're enrolled in one pathway, and if you stick to that pathway, the idea is that you should be able to move along, sequence accordingly. That means at the end of it, you haven't got any overlap of topics, you haven't got placement at the same time of topics, those kinds of issues that often come and bite us in the backside or have in the past. So stick on that pathway as much as you can. And each topic will have a flow site. Who's already been on Okta? Yeah, oh, brilliant. That's what I like to see. So Okta gets you onto your flow site. Your flow site is usually accessible a week before your topic commences, which is why you're probably thinking, if you've enrolled in semester 2 topics, why can't I see that? You won't see it until a week before those topics commence. But in your topic information, you will find a wealth of resources. It will give you your content from each of your, for your study plan for the weeks that you're in there. It will give you contact details. It will give you your assessment details. You have your topic coordinators who are always putting announcements up there, telling you what you need to do. So please make sure you become familiar with flow and the topics you're in. And one of the best tips I always have, I can't do it when it's big groups, but we did an orientation in the Riverland last week, and it was smaller numbers, and I was able to give them now a sheet of paper. And the sheet of paper was called Communication, a Framework, and a quick quiz. And at the top of it, the instructions were, read everything before you do anything. And there's 20 questions. And the first question was, what is your name? Second question, what is 360 plus 5? Third question, what is the capital of Australia? Very simple questions. You got to question 20, and it says, do not answer questions 1 to 19. Read everything before you do anything. You're going to get inundated with emails. You're going to get inundated with messages from your topic coordinator. We've all been there when we're trying to juggle work, family, study. It's all those balls up in the air, and you look at the subject line and you go, no, that's not for me, and you scroll past it, and the next thing you go, oh, I've missed the assessment. When was that due? And it could be one of those emails of your topic coordinator saying, actually, due to whatever, this assessment date has been changed, or due to COVID, the placement labs have been cancelled. God help us if that doesn't happen again. Hopefully not. My fingers, toes are all crossed. Read everything. I cannot stress that enough. Please read everything. No matter how much you feel inundated with those messages, they often have important information for you. Your assessments, usually students, it's the one that's like the knee-jerking, oh my goodness, how many assessments do I have? When have they got to be in? What do I do? Oh, how many words? Where do I get help? Can I ask for extensions? Can I read all these questions? Questions after questions. I'm not going to answer those. There is actually a student policy on assessments that tells you your rights and responsibilities and what you can do about extensions, about resubmissions, those kinds of things. But also, if you're unsure, ask your tutor in class. Because in week 1, I highly suspect they will go through all that information with you. And on that flow site that I talked about, there's also a document that's called the Statement of Assessment Methods. That will give you all your dates for assessment for every topic. It will give you when it's due by, when it's expected to be returned by, and what penalties those assessments may have. So, you know, if you're going to be late handing in an assignment, doesn't matter if it's even 5 seconds late, you get 5% penalty taken off per day. Worth knowing. So look at that Statement of Assessment of Methods. All that information is on your flow site. So our curriculum is usually a 3-year curriculum if you're coming in as a pre-registered nurse. If you've done a diploma of enrolled nursing and are registered with APRA, then what can happen is you can gain credit for the first year, meaning you do a 2-year degree program, or people like yourselves who, or for the majority of you who are graduate entries, you do a 2-year program. What we do have an expectation of you, though, is to have a basic knowledge of anatomy and physiology, and that's to help you. It's not about making our life easier. It's because in the past what has happened is students who've come into a graduate entry program, they're coming in at a second year, which if you see from here, you're focusing on pathophysiology and clinical skills development. We need you to have those foundational knowledge, yeah, so that you don't end up failing or struggling with that work. And the third year moves you on from looking at your skills, knowledge, attitudes, improving and developing your clinical skills and your anatomy and physiology, but also then moving on to help you transition into the profession of nursing. So helping you consider what do you need to do to be able to walk onto the wards or a community area, wherever you're going to be working, and think, I'm a capable, competent, professional nurse. So the third year is about clinical advanced thinking, about decision making you need to be. So that's how we move you through the 3 years. Okay? So now I'm going to pass you on. I told you she would appear at some point, and I was starting to panic a little bit because I was thinking, if she doesn't appear, there's no way I want to be left with all the questions she's had over the last 2 days. So I was starting to sort of just think, oh, but let me introduce you to Leanne Pront, who's our placement education coordinator, or is it, yes, education coordinator, is it?
Placement education coordinator, yes.
Yes.
And my PowerPoint's not on there because it's your profile.
Oh.
So, do you want me to just, I'll just get them up about Slido if you want while you're doing that. Awesome, excellent, good idea.
While Leanne gets organised, I'll just remind you about Slido as well. We've got that up and running. So if you think of anything while you're listening to our presentations today, please jump on the website, slide.do.com, pop in the password, which is OWKBNGU, and you can submit your questions there and they'll come through and we'll be happy to answer them, because I know sometimes you get to the end of the session and go, oh, I wish I had answered that, or I wish I had have asked that question. So yeah, feel free to do that at any time. If we don't get to them all today, then we will be doing a frequently asked questions page, and we'll send that out to you guys as well so that you can look back on it, because we know that it's a lot to take in on one day. So yeah.
And hold your hand up as well so we can see if you've got a question.
We don't mind questions.
We don't mind questions.
No. Okay, so let's get this show on the road. So the first thing, welcome. How you going? Who's excited about undertaking a Bachelor of Nursing degree? Ooh. Well, there's a little bit. Oh, look! Jess is really excited. Awesome. So what part of it are you most excited about? Placements. It's always the way, isn't it? Awesome. Meeting me. I don't know if she told you, but I'm also going to be your 1012 topic coordinator. Yeah. We'll be right. We'll be right. Okay, so what is a placement? That's what we're going to have a chat about. We're going to have a chat about when and where you will undertake a placement across your program, what the purpose of a placement is, the process for you being allocated a placement, and what you need to do in order to be eligible for a placement. Okay, so hopefully by the end of this short session, you will have a better understanding of what's expected. So, first of all, a placement. Core requirement, really, isn't it? Nursing is a doing profession. In order to be competent in your skill set and your knowledge, placements provide you an opportunity to experience, observe, bear witness to, and practice your clinical skills in a real-life clinical environment to real live patients. So you need to be confident and competent in your ability to deliver the care that you're meant to. Make sense? Awesome. Where will you find the information out about your placement? If you type into the spacebar on the Flinders website, nursing placement, thank you, mate. Sorry, I pace. I'm sorry. I need to apologise for that right now. It will come up with your placement website. Okay. Now, this is your first port of call for all things placement related. Yeah. If you are unsure with the information that you have read here, perfect.
One?
Yep. If you're unsure, please go to the front office and ask at the front desk to speak to somebody from the placement team. Okay? They are the people with all font of knowledge around what you need to do to meet placement compliance. Okay? If they're unable to help you, they will find somebody who will. Okay? Does that make sense? Excellent. Okay. So on the placement website, there are 3 yellow boxes on the right-hand side. These 3 boxes are crucial pieces of information for you. This one is a flow chart.
Oh, I thought you were going to the next one. There
Sorry.
you go, getting back up again.
This one is a flow chart that walks you through prioritising your compliance requirements. And when I say compliance requirements, I mean things like your immunisations, your police checks, your proving to our clinical environments that you're not a murderer. Because I don't want a murderer looking after my parents, do you? No. That you are of sound mind and body, physically fit to undertake the role of nursing. Okay? These requirements are preset by our industry partners. We do not have a choice in them. So what's not set by our industry partners is set by our professional bodies. Okay? Bottom line to this message is, if you do not meet and complete all of these requirements, our venues will not provide you a placement because you haven't proven that you've met the criteria to be safe to deliver care to their patients. What a nice security net. That's very good, isn't it? So, another key message. Start yesterday. Yeah? You'll hear that again in a minute. So, really key, can we go to the next one?
Next one.
Really key piece of information for you. What do you need to do to meet compliance? This document, can we just walk down a bit, Deb? This document will outline all the criteria, and please note, right up here on the right-hand side, each of them have different expiry dates, just to make it more confusing. No, that's not really the reason at all. All of these requirements need to be met before you are allocated a placement. Every placement topic. So it is your responsibility to ensure that you update these criteria in preparation for your placement. Okay? You will be reminded, you get a series of emails from the placement team. We note you're enrolled in Nurse 1012. Your placement compliance date is... You already got them? Yeah, very good, very good.
She's my favourite student.
Yeah.
So far.
Oh, really? Excellent. When you download this document, the pieces of information in blue are the links to these criteria and will assist you in completing them. Okay? Read the instructions carefully. Things like your police check need to be worded specifically. Okay? If they're not worded specifically, a venue won't accept you and you'll have to apply for another one, which is quite problematic time-wise. Okay? Some of these things take some time, and as all universities are coming back into a new semester, they're all starting large groups of students. There's going to be a large number of people applying for these elements of identification and clearances across the country. So, you know, the more timely you are, the more efficient they can be, the more time you'll have to upload it. Okay, next one. Any questions about that? Excellent.
You want this one?
Yes. So where will you find the dates? If you're not sure, this yellow box has your placement compliance due dates for this year. Okay? So for 1012, in essence, the 12th of March. So that's actually 2 weeks away. Who has not started their compliance criteria? Okay, so there's a few of you. Most of you have. I'm super impressed. Well done. Well done, guys. Now, I'm going to be really honest. Some of these processes are outside of your control. Okay? You can apply for a police check or a DHS clearance, and once it's in the system, none of us can control how long that's going to take. Okay? So in your emails that you receive from the placement team, it will make a statement something like, should you require an extension, please use this online form. Yeah? If you do not apply for an extension, then we're making an assumption that you don't want a placement. Okay?
I have a question, Leanne.
Absolutely, Deb.
What happens if I just forget?
If you just forget and you do not apply for an extension, okay. So the 12th of March will come and go, and the very next day you'll have an email. And the email will be, hi, we note you're still enrolled in Nurse 1012 and you remain non-compliant for a placement allocation. Are you intending on doing a placement in this topic in 2021? If you are, you have 3 days to contact the placement education coordinator, which would be me, and justify with evidence why you haven't done what you've been asked to do.
That's why you read emails.
That's why you read emails. And then you email me and you go, oh my God, I'm just disorganised. I couldn't get myself together. I have had this happening in my life or whatever, and we'll have a conversation and we'll try and find some strategies to support you, okay? If you do not contact me within 3 days and decide about the 22nd of March to email me.
Or maybe a week before placement.
Well, they won't have a placement. Everybody else has got their placement and I haven't got mine and I don't know why, is what I often get. And I'll go, oh, thank you for your email. I note that you were sent all these emails from the placement team. You were then sent an intention to undertake a placement email on the 12th of March. Our records show you have not responded to that email till now. I'm really sorry, but you do not meet compliance and will not be provided a placement. Ba-boom. Not the email you want to get, okay? If you're working on compliance and there is something that you're waiting on, it might be a blood serology, it might be a screening document, it could be a whole range it might be TB clearance. Apply for an extension for each of those criteria. And what that means is that the placement team can track how you're travelling and can highlight if there are any concerns. So, for example, if there is a large number of students waiting for TB clearances, then we can have a conversation with the chest clinic, if that's what the issue is, okay? But if you don't communicate with us, we cannot help you. We are really, really good at helping because we're nurses, aren't we? Aren't we? But we are crap at reading people's minds. Yeah? It's a skill I would like to learn, Deb.
Me too. Can I just reiterate, though, that the placements are attached to topics, and so if you're not going on placement, then, of course, you have to consider that's going to have implications for passing that topic.
Oh, yes, absolutely. So that is the other message, isn't it, Deb, to be brutally honest? So, for example, and we'll use 1012 because you're all graduate entries, yeah?
No, we've got a couple of others in there just to confuse us.
Oh, excellent.
But the majority.
So who is enrolled into a 3-year program? One? Excellent. So you won't do a placement until semester 2. So that buys you some time. However, in 1002, there will be an assessment around some of the compliance stuff. And they will talk to you about that next week, okay? So what that does is help you prepare for placement. For anybody else that's doing a 2-year pathway, you don't get that luxury, okay? You are already either an enrolled nurse or have previously completed an undergraduate degree. By those 2 qualifications, we're making an assumption that you are super organised, super efficient, and can study and put your hand up when you need help, yeah?
Are you not looking at these faces? I'm seeing these people in front of me.
Oh, no. They are super organised and super efficient, which is what we're assuming. So you guys have already been through an educational process that has timelines, and we expect that you bring that knowledge and understanding and skill set with you into this program, yeah? Excellent. The other thing that you need to be aware about is on the placement website is a whole heap of information. So, detailed compliance information. So if you're unsure from the checklist, it will take you to these pieces of information. So things like your police check, it outlines what needs to be, where you can get it, but also the type of check. It must have those statements that it is about a vulnerable group and unsupervised. Okay, so a whole range of information there, information around your uniform, how to prepare for a placement, where to get your clinical badge, preclinical meetings, and fitness for practice. Okay? Is that clear as mud?
Can I just point out this webpage is also accessible from a link on all your flow sites. There's a button at the top of all your flow sites saying nursing placement website or something like that. But yes,
Yeah. Everybody hear that? Yeah, at the back, you could hear what Jessie was saying? Yeah, good.
Excellent. Okay, so moving on, we've got compliant. Yes. Hang on, so that everyone can hear.
No, I just want to say, if I have all DHS police clearance and everything, can I just upload straight away there?
Told you. Wow.
I think I need an ambulance.
We're just not used to this.
Absolutely, you can just upload them. I will show you where in a minute. Okay, so that's a really good question where you're unclear to go down to the placement team in the front office. So go up to the college front office at the desk, say, can I please speak to someone from the placement team? Show them what you're trying to do and they will be able to clarify that for you. All right? Because it's much easier to see it in front of you. Yeah. Awesome. I am so impressed. Oh, perfect end to a week. Okay, so it is your responsibility to have your placement compliance documents in date for the duration of your placement. Okay, and it is a trap that many students fall into. They go, I'm not due to update my CPR until May. Middle of May. I start placement at the beginning of May. I'll do it a couple of weeks before I do placement. The reality is you have to be compliant well before that to be allocated a placement, and we'll go through that process in a minute. Nursing placement calendar we've looked at, and the compliance checklist we've looked at, and the process. So use that process to prioritise where you would start with your placement compliance criteria if you haven't already, okay? Use the information in the emails that says if you need an extension, please apply for one. So, we're going on a placement. Yay! How exciting, Jess. No, I'm coming too. Okay, what sort of things would you expect, what sort of environments would you expect to go? You guys are looking at 4 placements across the next 2 years. You will be 5, okay? In general, your first placement will be an aged care setting, okay? You will expect to do a placement in a general medical surgical ward somewhere or a community ward. You will also expect to do at least 1 rural placement at some point in your program. You will also have the opportunity to do a higher acuity placement. Okay? We have a responsibility to you to provide you a variety of placements, because at the end of your degree you are going to register as a registered nurse generalist. Okay? So our responsibility is to provide you a variety of placements to increase your learning and exposure to different clinical environments. 2 questions I always get, and I'm going to try and negate them right now, Alicia. One is, do I have to do a rural placement? My answer is absolutely. So a rural placement will offer you a diversity of experiences that you cannot replicate in Adelaide. It is impossible, okay? You will be allocated a rural placement at some point in your program. Now, some of you will go, but but I've got babies at home, or I've got children with this, or I've got something that means I can't leave my family. We do understand that. And should you be in that position, there is a process where when you get sent your email, again, check emails. It says if you are unable to or have difficulty in attending this placement, please apply for a placement variation, okay? You will be required to meet some extenuating circumstances. So if you have some evidence to support your application, that would certainly help in having a favourable decision for you.
I have a question, Leanne. What if I just can't drive and get to a rural placement?
Most of our rural placements have public buses to them.
Oh, I have to catch public transport.
Yeah. So one of the issues, so right down, next down says required to arrange own transport to and from placements. And that's whether you're going rurally or whether you're going out to the Lower McEwen, which is in our northern suburbs of Adelaide. Does that make sense? Okay. If you have extenuating circumstances, we will certainly support, we'll do our absolute best to support you. Aged care. So one of the common questions, I already work in aged care, I'm a carer, I don't need to do a placement in aged care because I know everything about aged care. Well done you. That's wonderful. I'm really pleased to hear that. The problem is, the role that you're employed in aged care for is a carer role. The role that you're training to be in an undergraduate Bachelor of Nursing program is to be a registered nurse. They are very different roles. The expectations are very different, and you will still be required to do an aged care placement. Okay? Done? Got them
Any
too?
questions before I'll go up the back, Leanne, there's a question up the back.
Okay, just while you're going up there, Deb.
Yep.
Accommodation around rural placements, we will do our best to support you with that.
I'm not that
The college
skinny.
also has a reimbursement process where you will have to pay for your accommodation up front. Usually it's about $100 a week or $150 a week, depending on where you're going. And your transport to and from, you will be able to, once you've paid for it and completed your placement, you can apply for reimbursement of those costs, and the college will support you with that. So that's pretty helpful for an amazing learning experience, yeah?
If I'm already working in an aged care home, can I do a placement in aged care with the same current employer?
Absolutely not. And with respect, the reality is if you work in one aged care space, so say for example, I'm employed right here and I work in aged care right here and I want to do my placement right here because I'm safe, I know everybody, it's really easy, I can drive there, it's not a problem, I can do placement there, absolutely. The problem is everybody in this space recognise you in the role that you're employed in. And so they expect you to be the carer that you're employed to be. They expect you to undertake these activities in this way. The reality is when you're on placement for a Bachelor of Nursing degree, we want you to learn and have the opportunity to be exposed to a range of opportunistic learning that present, which means you might be asked to come and have a look at this, come and have a go at this, right? Which won't happen if you're in your workplace because they already have a plan for you every day, okay?
So a no then.
If I haven't done a manual handling course, but I've got one booked in for after the 12th of March, is that all right? Do I still have to
That is a great question. So what you've just shown me is your planning. You have booked in, so now you just need to apply for an extension with the evidence of your booking receipt. and then we will certainly provide you an extension to that, no problems. Okay?
Any more while I'm here? Okay, right. I'll come to you and then you at the end, okay?
We've got a couple while we're moving around that we've got online as well, Leanne. So what is EMR in the in-place compliance details?
EMR is an acronym. Welcome to nursing.
Yes.
We use lots and lots of acronyms. It is an electronic medical record. So many of our larger Adelaide environments are either currently using electronic medical records or transitioning into electronic medical records. So what these environments have asked is that our students do an educational package on that in order to be able to access patient records when they go on placement. Okay?
Perfect. Okay. I'll just take it in order.
Yeah.
I'll hold it just because of COVID.
Yes, since we're doing the rural placement and I applied for the Menlaton area. That's very far away from home. So how about the accommodation? Do you support us for the accommodation? I mean for the accommodation.
So the question is, how will we support you in relation to a rural placement accommodation?
Yeah, are we going to arrange for the accommodation or are you going to arrange for
Okay,
us?
good question.
Who sorts it?
So how do we get that happening? Okay, so in the college team downstairs, we have a lady by the name of Lizzie who is amazing, and she supports our international students to source accommodation when going on a rural placement. Outside of that, we have a team that sit in the broader university system called the Rural Clinical Accommodation Support Team, something like that. I can never remember because the acronym's about that long. And the person you will be communicating is a lady by the name of Naomi. Now, Naomi is amazing. And she will send you, once you're allocated a rural placement, she will send you an email that says, oh, congratulations, you're going to Sejuna on your first placement. How wonderful. These are the available accommodation if you wish to use them. Now, it is your responsibility to respond to that email, because if you don't, then she's making an assumption that you've got friends there that you're going to stay with, or you've got family there, or you're taking your whole family and you're going to stay in the caravan park. Why not? Sejuna's got great fishing. Why not? So the bottom line here is, yes, we will help you. We will generate an email into your inbox, so check your emails.
Check your email.
But also respond to your emails, because the lack of response is what students end up in the most trouble with. You know, we're all procrastinators to some point, but if we sit on an email for too long, there becomes an assumption that you're either not interested or not wanting what's being offered. Okay? The other amazing rural placement, well, it's really not rural, it's remote, is the Northern Territory. Oh, yeah, wow. Don't start us, because Jess and I will get sidetracked. Okay, so in next semester, you guys will be able to apply second semester, second year.
Yes.
Okay.
Excluding one.
Yep. Second semester, second year, you will be sent another email from the placement team seeking your expression of interest to undertake a placement in the Northern Territory. Okay? It comes with an application form. There are a series of questions that if you are interested in this amazing learning ground, you are encouraged to in detail respond to those questions. All right? Your application will then be reviewed, and you will either be selected or you may not be selected. And often it's dependent on how many applications and how many placements the Territory have available for students at that point in time. But there are some amazing, and I mean amazing, learning experiences in both rural South Australia and remote Northern Territory for you as undergraduate nursing students. I only wish I was sitting in your seat now.
I've never known a student go...
Oh, absolutely. And yeah, so the first opportunity you can apply for is in second semester, second year, but you can also apply for it in each of your semesters in third year.
Yeah.
Yeah.
So I've never known a
point.
student who has been to the Northern Territory and not just thoroughly enjoyed it. They come back with some amazing stories of their learning, what they got to experience, and it doesn't cost you anything to apply, to do it. So seriously, consider it.
We've got a student at Catherine at the moment that's got a TPPP, so that's the graduate program after she's finished her Bachelor of Nursing, literally off the back of her placement.
Yeah. Okay.
It's quite common, yeah.
I asked it online, but I figured I may as well ask it here too. So I've been looking at InPlace and trying to upload stuff, and I noticed that there were two things, like the COVID declaration, which was meant to be done like a week before, and the flu vaccine, which isn't out yet. What do we do for those few?
Good questions. So, on your InPlace, when you go to click onto the COVID declaration, if you read the notation that says there, you are required to complete this within 7 days of commencing your placement. So it's not a criteria for allocation of a placement, it's a criteria for entry into your clinical placement. You'll need to take that with you when you go to your placement. And essentially what that's saying is you have met the criteria for SA Health at that point in time in order to minimise transfer and of COVID, okay? I have a question. This possum was waiting longer.
Sorry. I'll get that.
So I'm not sure whether I'm the only one. We got the email saying that we were able to nominate the rural placement ourselves. I nominated one, but then now it's disappeared in my system.
Oh.
Okay, just breathe. It's okay. It's okay.
Disappearing emails.
It's okay. Okay, so if you are concerned, go and have a chat to the placement team. All right, they'll be able to guide you specifically because they'll be able to see what you're talking to on your profile. In general, students who are sent an email around what we call the self-selection rural placement, there is a small window. With the understanding that everybody in our program has to do a rural placement, students tend to be proactively choosing when and where they will do their rural placement. Okay, so when you get the email and it says, would you like to self-select a rural placement? Yes, because I want one as close as home and at this time and at this and this and this. Done. Okay, so everybody in that window is doing the same thing. Okay, they will then be reviewed because, as we said before, we have a responsibility to ensure that you have a variety of placement experiences. All right? So each of those selections will be reviewed to make sure you're not going back to the same environment, to make sure you're not doing your third aged care placement, all of those things. And then they will be published once you're compliant. Okay? But if you're not sure, have a chat to the placement team.
Okay, this gentleman's been waiting.
With the rural placements, if I only want to go to Catherine and nowhere else, is that possible?
Good question. Really good question. No. You can, so on the Northern Territory application form, we ask that you nominate several. And the reason why we do that is simply because of potential availability at the time. So when we're talking about environments such as remote areas like Catherine, it's always really dependent on staffing levels. And it's always really dependent on the environmental conditions at the time. So if there's torrential rainfall in some of those areas, you're not going to get there. and or get out if you're on placement. So those things we always sort of need to have a caveat in the background just in case something's occurring in the environment that we may not be able to either send students or send more students to that space. We'll do our best. We always do our best to try and not, get you into your first preference, but there's never a guarantee. Okay?
Anything else before we move on? One more. I'm going. You stay. You've got centre stage.
One here. One. Yep.
Okay. This is about the uniform.
Yep.
And I have a friend who had the uniform in the past years, but you've changed your uniform, right? Now the question is, can I use that uniform?
Can you use the old uniform, which is the T-shirt with the collar? No. No, and the reason is because we have reviewed the uniform with the view of presenting you in the best professional image possible. And so the new shirt looks 1,000 times more professional than the daggy old T-shirt, okay? Remembering that first impressions count, okay? Now, I'm really tardy this morning. I've been late. My PowerPoint wasn't even on the system. So, you know, the image that you guys are already perceiving of me is that I'm a bit slack.
She's not, I can assure you.
But this is about first impressions, yeah? So when you present to your placement environment, you want to present like every other Flinders student in the best professional attire that you are required to, okay?
I have done my manual handling at my workplace last week, but I couldn't get it on the letterhead or in the form of a certificate, but they have sent me a confirmation email. So is it possible if I take a snapshot or the printout, is it acceptable?
Take a snapshot. One of the criteria around manual handling and CPR is the statement as to whether it's theory and practice, or for CPR it's about the level of the qualification. So, okay, send it through to me, leanne.pront@flinders.edu.au, and I'll have a look at it for you. Okay, not a problem. Yes.
Just regarding uniform, do I need to be prepared just before my first lab class?
Great question. We will give you some leniency. So, remembering that every commencing student in Flinders nursing degrees will be hunting a uniform, okay? And whilst our provider, Valerie Travis is really, really good and really helpful and supportive of students, sometimes it might be a sizing issue that there's a bit of a backlog, okay? If you do not have a uniform but you've ordered it, then please make sure you come to the clinical labs with closed-in shoes, leather preferably, okay, with either trousers, ideally long trousers, or a culotte or skirt. Professional, not scrubs. And the reason why I say not scrubs is because there is a range of quality that scrubs are available in, and after a couple of washes, some of them look pretty dodgy. Okay, so we want sort of dress attire. Remember, we're trying to put you in the best image for first impressions. And a T-shirt or a shirt that ensures that you are bare from the elbows down. Okay, and that's about infection control, and we'll go through that next week. Hair up. The criteria is actually on the placement website around uniforms. All right, does that help? Awesome.
That's right. Yeah, we've got a couple of questions. Is it possible to do our aged care and rural placement in one? If we do this, do we have to wait for both until second semester?
So I'm assuming that this is a BNGG student.
I think
so. I apologise to whoever sent that in. I'm making some assumptions here. Yes, you might tick 2 boxes around doing an aged care placement in a rural setting. Please remember, though, that what is provided to us by our clinical partners is what is available to you as potential placements. So whilst this is the ideal for you, it may not actually be possible at the time you're doing a placement. Okay?
Excellent. I placed my interest in a certain aged care rural setting, which will be starting in June 2021. Does that mean I've completed both my aged care and rural placement requirements?
Can you just pass that by me again? I think I got lost. Sorry.
So, yeah. So, you know, we offer a variety.
Yeah.
What they're asking is if they do both at once, 2 in 1, are they double dipping? Do they still have to do it separately?
Absolutely. So, and like I said, yes, you might be able to tick them off. The reality is we say you will be required to do a minimum of 1 rural placement. If your experience requires you to do a high acuity placement and we can secure you emergency in the Riverland or emergency in Mount Gambier, why wouldn't you take it? Because there you will be exposed to amazing different presentations with some limitations to resources that you don't have, that metropolitan emergency departments have. That means you have to work really closely with the team. You have to think really critically on your feet, and will bear witness to a range of retrieval experiences that comes with that environment. I cannot reiterate how valuable rural experiences for learning are. You will get diversity beyond your imagination. If you're allocated a surgical ward at Flinders Medical Centre, you will see on Mondays gastrointestinal surgery, on Tuesdays ear, nose and throat, on Wednesdays gastrointestinal surgery, on Thursdays ear, nose and throat, and on Fridays it could be a combination of that. Okay? So you will see similar presentations on that ward, which is great for learning. Please don't take that away from the learning experience. But if you were on a surgical ward in the Riverland, Port Lincoln, Mount Gambier, you would see different specialists coming. On Mondays it might be orthopaedic specialists. You might get to go to theatre and see a hip replacement or a knee replacement. On Tuesdays it might be ear, nose and throat day. On Wednesdays it might be gastrosurgery. On Thursday it might be
cardiac.
Terps. Oh yes. Urology. Oh, messy business. Yes. And on Fridays it might be what might be called lumps and bumps, where the local GPs come in and do different procedures. So 5 very different learning experiences, 5 very different ways of approaching a surgical procedure or managing a surgical patient. So the diversity is exceptional. I'll get off my bandwagon.
She's a little bit passionate about rural, if you haven't picked up on that already. Do we have another opportunity to put preferences in for rural placement for next semester as well?
Absolutely. So every semester you will receive an email. Check your emails. An email from the placement team seeking your preference for a rural placement. Okay?
Nope, that's it.
Okay, so just up here.
You see, I'm getting my steps up. I will be fit by the end of this. Where was it? Oh, there we go.
So just while we're doing that, this is the process whereby we speak to our placement providers and follow that elicits you a placement. Okay, so this is a 12-week process, and within that process, the expectation is that you've achieved compliance at a given point. Okay, if we do not secure the placement with our placement providers, we lose it. Okay, and trust me, in this system, there is nothing worse than a placement that nobody can use, because that's a wasted learning experience. So hence why our messaging is, have you started your compliance? And if not, you should have started yesterday. Okay?
If you're interested in a speciality versus a location, how do you communicate that I want to go to emergency and I don't care where in South Australia I do emergency?
Excellent question. So some of you potentially already have engagement with the health industry and already have a mindset of where you might like to be specialising. Great. So 2 key points there. One is, in 3rd year, or as you finish 2nd year, send an email through to the placement team highlighting your interest. We will note that. We cannot guarantee anything, but we'll do our best. If an emergency placement is available in your block, we will do our best to allocate it to you. We're a little bit bound by what's on offer by our venues, so we'll do our best to facilitate your interests. The other piece of advice I would give you, if you are black and white in where you want to go, is be mindful that you don't close yourself off to the other experiences on offer. Okay? Awesome. Okay. Let's move right along. Okay, so preparation. We've talked about Valerie Travis's around uniforms. Most of you have already got a student ID badge card? Excellent. Have you got a clinical ID badge? Nope. All right. If you ordered it online, you can order it online. If not, back up to Flinders Connect and they will be able to do it for you in minutes. You do not need your student ID and that other information that's on your ID card to be on your clinical ID badge. Okay? You don't need that out there. Placement compliance. Did you start yesterday? Yeah? Awesome. Topic requirements. So for most of your placement topics, it's not only about getting compliant for placement. You'll do all the tutorials and clinical laboratories where you will apply the theory to practice in developing your skill sets. There will be some other hurdle assessments along the way. Things like medication calculations.
Did you hear that? I did. It usually brings most anxiety.
I know. So my question to you is, if I got 80% for my medication calculation, would you be happy for me to give your mum medications? Probably not.
He obviously doesn't like his mum very much.
We won't share that with mum. I know I wouldn't. All our clinical environments require that our nursing students who are at the level of administering medications, which you will be, except for 2nd year, you have to prove that you are able to safely and competently complete a medication calculation assessment. Now, this isn't just about us being mean. It's actually a professional requirement. As a registered nurse, you will do it as part of your mandatory training every year. Every year. In your undergraduate program, you will do an assessment in 1012, you'll do an assessment in 2011, and you will do an assessment again in 3rd year. And the reason for that is because we will incrementally increase the complexity of your medication administration as you move through the program. There are a whole range of resources available to you in the university where you can be supported around developing your medication competency, medication calculation competency. And you'll note I haven't used the word maths anywhere in there. Not once. The reason is because you come to university with the expectation that you can do long division, you can subtract and divide and add, do ratios, all of those things. If you already know that you require some support with that, then the Learning Centre will be able to help you with that, okay? Questions about that?
Well, that's a first.
That's a first. We must be improving with age.
Yeah, and obviously confident.
One of the other hurdles is what we call a pre-placement clinical intensive or assessment. Essentially, what we need to do is we need you to prove that the learning that you've undertaken during your topic, which is preparing you to perform those activities on real-life patients in a clinical environment, is that you are safe and competent to do so. We have a responsibility to the public to ensure that any student going out on a placement is safe to do so. Okay? So if you do not pass your pre-placement clinical assessment, you will probably not be going on placement. If you do not pass your medication calculation assessment to 100%, after 3 attempts, you will not be going to placement. Okay, we have a professional responsibility to protect the public, and our clinical partners, placement providers, have that expectation of you and us as an education provider. Okay?
Just got another question that's just come through about placement blocks. This one I might be able to answer. There's 2 placement blocks showing. What do I do when I'm not going on placement? So this is a timetable issue, I suppose. So what happens is you will be allocated a 4-week placement within that 8-block period on your study plan. So you will go on placement for 4 weeks anytime during those 8 weeks. For the other 4 weeks, you get a break. So you're on leave, you can go to the beach, you can have a bit of a rest. Don't go on holidays, please, because if you go interstate and we have border closures, it's just a nightmare. That's probably my biggest advice at the moment. Please don't leave the country or leave the state.
Don't go planning a wedding.
Don't go planning weddings.
Or pregnant. If you're even thinking about pregnancy, come and talk to me first.
Or get married. Can we add to the list?
Don't get married.
Don't get married. Don't go on holiday. Actually, you're just studying for the next 2 or 3 years.
Yeah. And if you are going to do any of those things, please come and see me so that we can have a bit of a chat on how that will impact on your study. But yes, you will notice on your timetable you'll have 8 weeks blocked out for placement, but you will only be allocated one 4-week block of placement. And in place we'll be able to tell you exactly when and where that is. So yeah, enjoy your 4 weeks break.
Are you allowed to go on placement if you're pregnant?
Absolutely, you're allowed. Pregnancy isn't a disease. Okay, we'll just establish that first. And I'm sorry, it does appear that I'm quite flippant. It's just that our clinical environment, our clinical partners will demand that you not be on placement 6 weeks prior to delivery of your baby or 6 weeks post delivery of your baby. So what that means for students, particularly in your pathway, if you are looking at having a baby or about August, September next year, your placement is in jeopardy next semester, because 6 weeks before that, okay, so that applies to the clinical laboratories. I can't do the labs. I can't go on placement. Can I do my placement a bit later? Well, that's a possibility, but actually you need to do the learning first. So it gets really complicated. So if you are pregnant, please come and see myself or Alicia, and we will help you with your timetable. Okay? So moving along, see this little icon up here? Who has set up their Okta? I am so impressed. In place is your placement database for all your placement information. So you'll be able to upload all your compliance documents to InPlace. You will be emailed from InPlace via the placement team. Your placement allocations will be generated out of InPlace. Your facilitator, the person who's going to support your learning whilst you're on placement, will also be identified in InPlace. Okay? So we're going to upload everything. So one of the key things about your compliance documents is please keep the hard copy in a folder that you can put in your backpack and take on placement with you. Senior staff on the wards may choose or request, as a result of auditing, that they view your original documents. Okay? It is their safety criteria and quality control checking that they will request to do so. Do not give anyone your original documents. They are yours, they are your personal information. You may be requested to photocopy some for a reason. Make sure the reason is valid. It's part of their quality control. That makes sense. Okay? So please make sure when you're on placement, you have them on you. If you do not have them on you, you will be requested to provide them to the venue within 24 hours. If you're unable to do that, you will be sent to me. Da, da. And we will not find you another placement. If you do not successfully complete placement, what does that mean, Deb?
I think that means you failed that topic.
Absolutely. And you come to me.
All right, so we've talked, so again, reminder, emails from placement team, read them carefully, follow the instructions, and do not give anybody your original documents. Communication, check your emails. Read your emails carefully. Essentially, all the communication from the university will be around emails. Occasionally, we might use an SMS to your mobile phone, and we used it multiple times last year around COVID. Okay? So, again, check your emails and check your messages. That is the placement team's email address, and the number underneath that is the college office. If you ring that number and ask to speak to the placement team, they will put you through. When you're sending an email to the placement team, can I please ask that you put in the header or the subject line your name, your ID number, the topic that you're having a query about, and that will enable the team to allocate your email to the most appropriate person as quickly as possible. It will expedite the response you're looking for. These people manage around 3,500 placements. They are extremely efficient, but if we give them some of these cues, it makes them even more efficient. Okay? So some of the environments that you'll be going to are places like SA Health, which is our state governing body, some private providers such as Resthaven Aged Care or Calvary Hospital, Calvary Group, or places like Ashford, Flinders Private Hospital, so a whole range of environments. They will all do things a little bit differently. So again, the secret here for your success is read the emails that you're provided carefully. The instructions for what you need to do will be in the emails. If you view every placement as a potential job interview, it will increase your success. You need to be mindful that nursing in South Australia is a relatively small family. The impression that you leave during your placement will live in that environment. These teams see lots of students. They remember the exceptional student. They remember the not so exceptional student. And everybody that floats around in the middle, okay? So just remember that every time you present in this space, you are presenting as if it is a job interview, okay? You will be expected to work shift work. Do nurses work public holidays? Absolutely they do. Do they work weekends? Absolutely. Nursing is a 24-hour, 7-day-a-week job in many environments. So you will be expected to work public holidays. You will be expected to work weekends. You will be expected to work a late, an early, and probably a night shift. Not so much in your first placement, but from then on after, absolutely. I would strongly recommend that you do all of that, because in 2 years' time you're going to be a registered nurse and you may well be rostered night shift fairly quickly in your first year and be expected to perform at that level. If you have not been exposed to night shift before then, it's hard. 3 o'clock in the morning is really hard.
Trying to keep awake.
You either become really, really, really slow, or you get really, really mischievous.
I clean.
You what?
I clean.
You clean?
If it's quiet, only if it was quiet, but I would go and clean the clinic room or just to keep myself awake.
Just keep moving. Keep moving.
Keep moving.
So in order to develop those strategies to keep yourself safe, you need to be exposed to those experiences. So yes, you will be expected to do the variety of shifts. You will not be, and we've had a chat about this already, be doing a placement in your workplace. If we inadvertently allocate your placement in your workplace, please let us know. It is actually detrimental to your learning if you do not let us know. The other really key message is, whilst you are undertaking a nursing placement, you are not, and I repeat, not to work.
How many people here have got jobs? Yeah, you need to start saving.
You have enrolled into the program that offers you, if you're doing first year, a 10-day placement next semester. For the rest of you, you will be doing 2 20-day placements this year, and next year 2 40-day placements. So 8 weeks this year you will be on placement. Next year, 16 weeks you will be on placement. Start planning for your placements now. I'll go. It's okay. It's a generational thing, is it? No.
No. Do I need a clinical badge or uniform yet if I'm in first year?
Good question. You won't need one till semester 2. Yep. But you know, so what I would do for your planning is, if you were up the hill in the hub, do it at that time. It'll take 5 minutes.
She's in BNGU.
Oh! I take all of that back, because my focus was entirely around placements, because I'm extremely selfish. You will be doing clinical labs for 1002. The expectation is that you're in uniform. Good point, Jess. Okay. Roster will be provided by the venue that you go to. There will be some ability to negotiate shifts around, might be around transport, might be around dropping off children, but the reality is you will be expected in general to work the roster that you're provided, okay? It is really important that you complete the hours required for your topic. So if you're doing 1012, you'll be expected to complete 160 hours or 20 days at 8 hours a day. Okay? We've talked about completing placement requirements, and we've all started yesterday. Yeah? Sure? Good. Just checking. In preparation for your placement and the assessments that will facilitate your allocation to a placement, be active learners. And for those of you that are doing 1012, you will have a visit from me. Every lab is my aim, okay? So we will come and we will ask questions and we'll facilitate your learning and we'll prompt your thinking, but you have to come prepared regardless of the topic that you're in. Do the preparatory work, engage in the activities provided to you. This is the safe place for you to make mistakes. Then you'll be able to prove that you've learnt those skills safely in your preclinical assessments and then move on to placement successfully. Any other questions? One.
Sorry, one more's just come through. Why no work if it fits around my placement roster?
Great question. So when you are rostered on a placement, you are rostered at a full-time load. You are undertaking placement where you're in a new clinical environment where you don't know anybody and you are expected to learn. It takes an amazing amount of energy to be able to do that. On top of that, you'll also be working shift work. I guarantee you will be exhausted. If you then choose to be on placement for 5 days and then go and work somewhere and come back to placement and make a mistake, who's going to be liable for that mistake and who's going to cover the insurance for your patient? You have just breached our health and safety regulations. You have placed yourself in an unprofessional position by making a very poor choice. Every student enrolled in the program is also now registered with APRA. Okay, so that is our registering body, and you have now have an obligation to meet the code of conduct and standards expected of us. Okay, so do not put yourself in a position where you are potentially at risk by working when you're on placement. Does that help? Yep. Any other questions? Oh, we've got a couple up here. Hang on. I'll just go here first because it's closer.
Actually, she said that we have got 2 availability lots for the placement. So are we allowed to choose which one we want to? Or otherwise, till what date will you tell us that in which lot are we settled so that we can tell our workplace? Okay.
Yep, good question. As soon as you are compliant, if you're compliant on the 12th of March, your placement will be released as soon as possible after that and you'll be notified. So it is a moving feast. The sooner you're compliant, the sooner we can lock you in. The later you're compliant, the risk is the later your placement is.
Yeah, that's right. But in regards to choosing which block you go in, no, unfortunately, the placement team will just allocate you one or the other. So you don't get to choose block 1 or block 2, and it might not be that it's the first 4 weeks or the last 4 weeks. You know, if it might be in the middle if it's an ad hoc kind of placement. So yeah, they will let you know though.
Regarding placement compliance, if our compliance is set to expire midway through the year, let's say, can we just re-upload it to In Place, or do we have to send it through as an email to the people?
Great question. Any movement that occurs in anybody's profile around placements, so you were compliant last year, you've uploaded and reviewed all your documents, that will come up, so the placement team will be able to see that and verify it for accuracy for the coming year. So if you're planning in advance and renew something and upload it to your In Place, it will be checked by the placement team. Okay? So an example, because it is a bit confusing. If you choose to update it in May, reload it, and it will be ticked off for your next semester's placement. If you don't do it, you will get a series of emails for your next topic, and you'll need to meet the timeline for that topic. Okay? So if your timeline's September for semester 2, you don't have to do it until then. But if you're proactive, I would encourage you to be aware that it needs to be updated and do so, plan for it. Okay? Any other questions?
I was just actually going to add to that and just say it must be valid for the entire time you're on placement. So if it happens that you have a placement that and any of your compliance expires while you're out on placement, you'll need to do that before you go out onto your placement. So it must be valid the entire time you're on placement.
Okay, this lady just had one question as well.
Actually, I have nominated one rural placement for semester 1, but my pre-placement compliance is like Hep B second dose is after the due date of 12th of March, so I've applied for the extension. So my nomination will be still there, or I won't be eligible?
They're two separate things. They're not linked. So yes, you've self-nominated a rural placement, which is excellent. Your compliance, you're already doing what's being asked of you. So you've applied for an extension because you know that your next dose or your serology or whatever it is after the due date. So you've done everything right. Nothing is compromised. Okay? It's all good. Okay, any other questions?
No? Shall we move on then?
Yes, please. I will see you all, next week. Yeah? Awesome.
Okay, so I'll introduce you to the other course coordinator that I said would drop in at some point. So I'll let you say hello before I move on to Danelle.
Technology hassling me again today. I had all sorts of trouble yesterday. Hi everyone, I'm Pauline Hill. I'm a co-course coordinator for the Bachelor of Nursing with Deb. So as I'm sure Deb mentioned, if you get to meet and see either of us, it might be in our teaching capacities or our topic coordinator capacities or our course coordinator capacities. So we have 3 kind of hats that we all wear. I'm topic coordinating availability 1 of 1001. So those of you who are doing the 3-year program, I'll be your topic coordinator for that first topic. And I have a class, I think, on a Friday afternoon, if I remember. Don't you love Friday afternoons? So if you're in that class, you've got me. But enjoy the little bit of time you've got here on campus. Find your way around, have a good look, get orientated so that next week you're ready to go, you know where to go, you've looked on your flow pages and you've done all your pre-reading and you're ready to hit the ground running next week. And good luck. Hope you enjoy it. Thanks.
Thanks, Pauline. So I'm just going to hand you back to Danelle because she's got to be off somewhere. So we might have to just go back a little bit with the slides. But
Right, well, it sounds very exciting, doesn't it? So, yes, you all yell out, calm down. Yeah, I think everyone should stand up for a second and have a bit of a stretch because we missed our stretch. So everyone stand up. Come on.
Been sitting down for a while.
Stretch. That's the way. Didn't want to stand up, but don't you feel better now? Right. All right, so I actually wear a number of hats. I'm a topic coordinator for second and third year, so I will see you probably second semester. But also, I'm also here to support your journey as a student engagement coordinator. So sometimes life gets a little bit bumpy and things happen, and I'm here to try and help you get back on track. There will be times during your degree and you might think it's just all too hard and I'm never going to finish it, but you will, okay? So you've got a lot of supportive topic coordinators around, and also myself. So I guess my role is to provide you with an avenue to seek the help that you need. At this point, if you're new to university or you haven't studied for a while, you might not know where to go to, so I'm your person who will sort of guide you to where you need to go to. So when, I suppose, might you see me? So quite often your topic coordinator will refer you to me, so it might be a situation where perhaps you're not attending class, or they're genuinely concerned about you, or maybe you've emailed them and said, oh, you know, I'm really stressed, I'm anxious, I can't handle a lot of things at the moment, it's all too much, and that's okay, that's perfectly okay. And often a topic coordinator has hundreds and hundreds of students, so they may refer you to me. I will then touch base with you, and I love to meet the students, so I might invite you to the office, or if you're not comfortable with that, I'm happy to chat to you over the phone or on Teams meeting, and I will attempt to link you in with a service that might be able to help you. So you're also welcome to contact me directly, like if you have a confidential issue, perhaps you're not comfortable going to your topic coordinator, and you're welcome to come directly to me. So my details are up there. I live on this floor, the third floor, in the extreme corner over that way. So you can come and see me at any time. Then I generally have an open door policy, although I do teach, so appointments are preferred. So when you do see me, I may refer you to such places as health and counselling, perhaps for academic issues. You might be stressed about exams, time management might be an issue. I think someone's going to talk about procrastination and things like that. So you might need that academic help, or you might need some personal help through some qualified counsellors, and I can direct you to that area. So you are entitled to 6 free counselling sessions a year with health and counselling. That's an awesome service, and don't feel embarrassed that you're reaching out, because it's really important that you get help early if you need that to get you back on track to finish your degree. And sometimes these issues can spill over and impact more than one topic, so I'm also that useful person who might be able to facilitate that communication across a number of your topic coordinators to sort of, I suppose, to help you with that learning and get you back on track, so that one person's sort of involved and not 4 or 5 or 6 people. Also, there'll be areas you might not realise that you are eligible for, whether it's what we call DAPS, a Disability Access Plan, so whether it's a physical or a mental support that you might need, you might be eligible for that, and so I will send you to health and counselling, and there'll be a disability advisor, for example, who will chat to you, and you might be able to have access to that. You can also get referred to, because, you know, with all these crises that people do have in life, everyday life, you might have financial issues. FUSA, the Flinders University Flinders University Student Association, have financial advisors, so they might be able to get you on track. They have contact and information about interest-free loans you might be eligible for, crisis financial management and things like that. And they also are a really good organisation for if you want to get involved with societies or sort of really embed yourself in the university lifestyle and get involved with some networking. There's a good opportunity there as well. So basically that's me in a nutshell. There's lots and lots of different services that I can refer you to. And like I said, at this point, maybe you don't know what you need, but there's something missing. And perhaps by having a chat to me or even your topic coordinators, we might be able to find that little niche in that area to help you out. So basically, I'm not a counsellor. I'm certainly really good at listening. And my job will be to link you in with someone who will be able to help you on your journey in nursing. Because at times it can be overwhelming and it can get too much. And you just need someone to say, that's okay, and here's someone who might be able to help you. So I think that's about it, really. I guarantee you that it's not always going to be easy when you're doing this course, but it'll be really worth it in the end. All right, so that's about it for me. All my details are on screen, but feel free to contact me if you need to.
There we go. Thank you. Thank you. So as Danelle says, don't struggle alone. Seriously. We don't know what we don't know. We've got no idea that you may be having issues in your family life, home life, employment, finances, having to care for relatives, children, unless you tell us. And we will do everything in our power to support you, because we want you to succeed. You are our next generation of nurses. So we want to build a capable, competent workforce. But with that, we need you to take some accountability and say, I'm an adult. If I'm struggling, I actually need to acknowledge that and seek the right help. So go to your tutor, go to your topic coordinator. They can either refer you to Danelle or you can refer yourself to Danelle. But go and get that help. We want to keep you engaged. I can't say that enough, seriously. So just a few bits before I'm going to pass you on to look at some issues about time management with Pauline. So welcome to the profession of nursing. The word privileged is an important word. My background is in mental health nursing, and so I spend a lot of time, or when I was clinical, spent a lot of time with people listening to very personal issues. And I don't think it matters whether you're a mental health or physical health. If it's to do with entering a person's world and their space and going into boundaries that you wouldn't normally cross, because you've got to touch them, do things, you know, then that actually means that you are in a privileged position. Somebody is allowing you to do that. So you need to feel and respect that person and value that person in this privileged world. They're allowing you to enter that so that you can then help them with their needs. Nursing has got such a diverse range of specialities. It may be that you do your nursing, have a taster on a placement and go, I loved that. I want to go and do extra training in that area. Come to mental health. Be a mental health nurse. But it could be any area that you want to go to. But you'll get several tasters when you have a range of placements. You may have in your head already an area that you want to work. But you're going to see people from all walks of life, from all different ages, from all different cultures. And the thing that you need to remember is that, yes, you're a student and learning, but you are going to not learn just from us as academics or in the labs. You're going to learn from the people who you're caring for. They are the experts, not us. We can give you the foundations of knowledge and the skills you need, but they are the ones who know their own needs. They are the ones who've got the voice to say, I'm in pain, or I really don't like that, or I'm feeling uncomfortable. And because it might not hit your tick box of what you've been taught, it's about listening, valuing, respecting that person. So a lifelong profession, we expect you not just for the next 2 or 3 years to learn, but learn throughout your profession. And here is all academics, or staff, we are always learning, and not through courses that we may go on. We're learning from you, the experiences you bring, the conversations, the discussion, the narratives, the dialogue that we have in tutorials. You teach us many a thing that we then take away and go, wow, yeah, so we get to learn from you as well, always learning. A bit like Leanne's, did you do it yesterday? Have you got it yet? Nursing is amazing. You've made such a good choice. It's a brilliant choice. Yes, people have said you can go around the world. We don't just spout this, you know. We're not a marketing company that's just trying to spout you, yes, you've made a right decision. It's the truth. There's a number of people here who've worked in various places around the world, have various experiences, and it's a qualification that you can take to different places as well. So think about that. Differences of individuals, differences in your placements, differences in your postgraduate, you know, if you want to go to postgraduate, or the options afterwards, and the diversity that you're going to see and experience, because it's amazing. Oh, have I gone backwards? There we go. And I'm going to hand you over now to Pauline for... Oh, yes, you can. There we go. We have. No, it's here. It's ready. I've done it. There you go.
I'll let you introduce yourself. This is an amazing experience.
If you click on that, it should take you to the video.
Oh, fantastic. Thank you. Okay, so hi, my name's Kirsty, and I'm the co-president of Allied Health for FIRS, which is a club all about health and particular focus on rural health. We have a lot of fun events through the year, and we'd like you to come and join us. Particularly for nursing students, there's the option of the ride-along program with the RFDS, and so if you want more information about that, hit us up. Okay, so what that is the opportunity to go out for a day with the Royal Flying Doctor Service, and everyone that we've spoken that's done it has had a really good time. So it's a huge opportunity. It's pretty much only done here in South Australia. But yeah, have a look at the video, and if you've got any questions after that.
So FIRS is Flinders University Rural Health Society, and FIRS is all about giving students the opportunity who have an interest in rural or country practice to get exposed to it. So we run events all out the year, which is all about giving you guys a little taste of the country. So some of the events that we run throughout the year are like our rural high school visits, where we go out to rural high schools and talk to students there and tell them about the degrees that we're studying. Great thing about it as well is you also get to see lots of attractions the state has to offer, like the big orange out in the Riverland and the painted silos at Canalpin. Other events we run as well are experiences of the Royal Flying Doctors, where some people even get to go on the ride-along program with them. We always have our plastering night and wilderness health night, where we have the snake catchers come and have a talk and tell and show us all the snakes that they catch over the years. We've got a quiz night coming up this year, as well as the new Riverland camp. So great things coming.
Hi everyone, my name is Alison and I'm a speech pathologist working in country health in the Riverland. I've been here for 12 months now after graduating from Flinders in 2019. And during my time at Flinders, FIRS was a huge part of my whole university experience. I started out as the discipline rep for speech pathology, and then in my third year I had the opportunity to be the co-president for Allied Health. And if I had to pick my present to rural high school students, encouraging them to come to uni and study a health degree and sharing what you love about your degree. But at the same time, you just get to meet a whole bunch of other uni students from different health degrees and get to know what they're studying, but also just have a bit of fun. I think either way, if you sort of know that you want to work somewhere rural after you graduate, or if you just want to meet some other people while you're studying at uni, either way, I think joining FIRS would be great.
Hello, my name's Sam. Currently just an everyday member of FIRS, but in the past, in 2019, I was the co-president of medicine. Currently final year medical student and also the president of the FIRS Medical Student Society. I decided to join FIRS in my first year of uni because I was interested in rural health. I grew up in a semi-rural location and was pretty keen to sort of get involved in that throughout medical school, and it seemed like a really friendly bunch of people. My favourite experience with FIRS, it's pretty hard to actually think of what the best one was. There's quite a few. I think probably the RFS experience where you get to go up with the Royal Flying Officers and see what they do for the day and sit in the plane and see what happens at the base. I thought that was pretty amazing. But I also really enjoyed some of the other events like Women's Health Night and even just getting to meet a bunch of like-minded sort of students was a really great experience, especially the fact that it was multidisciplinary, so it's full of health, so it got me just out of being just in the medical sphere and getting to meet a whole bunch of people with a whole bunch of really, really interesting degrees. In terms of where I see myself going in the future, I'm pretty keen in career in rural medicine. I got to spend my third year in the Rossa Valley, which is sort of like semi-rural, and had a really great time there. I'm pretty keen to go back to working in that kind of environment. And I suppose I really got a lot out of FIRS in my, well, not done with my time there, but over the past 4 years, I definitely learned a lot more about rural health. I learned a lot about sort of like the inequalities of rural health and what we can do as students to really work on that. I got to go to the NRHSN National Council and meet up with a whole lot of other sort of enthusiastic and like-minded students. They taught me a lot and it was a really interesting experience. And I also, like I said, I got to meet so many different people around the uni, so many different degrees that I wouldn't have ever had a chance to interact with otherwise. And they've been really great, a bunch of my friends. So yeah, it's been a really great experience and I definitely recommend you join up.
So if you'd like to become a member of FIRS, register at the NRHSN website, and if you want to keep up to date with all our events and what we've got going on, follow us on Facebook.
So there you go. It's a little bit more information about us and our club. If you have any questions, feel free to talk to me now or just contact us via our Facebook page. We're also up at the hub today until 3 and have some merch giveaway and bits and pieces. So come and join us. We're a really fun group of people. Thank you.
You're welcome. Any questions before you go? So you're sneaking away quick. They're trying. Hang on, let me get a... Not, Leanne's loud enough, but just in case.
Do you originate from a rural environment, Kirsty?
Yes. Sorry. Yeah, so I grew up in a few different places. I grew up in Burra in the mid-north and then Lameroo in the Mallee as well before coming here. Living down in the city for a few years, and currently I live in the Adelaide Hills. So I actually fit into a semi-rural environment at the moment, which is quite nice, a nice blend. So, but you don't have to, by any stretch of the imagination. We've got some great students, particularly some of the med students at the moment, who are doing the John Flynn program, and they're all from the city, and they've never lived anywhere else. And over the next 4 years, they're doing about 8 weeks out in a rural environment. And they're loving it. They're getting to experience something different. So definitely, if you're ever interested in rural health or even just want to get away from the city for a weekend, we've got our camp coming up this year in the Riverland, which is really exciting. We've never done that before. And it's being supported by clinicians. So we're going to have a great group of people up there to help us out and teach us a few new things for the weekend as well. Other than that, we have our Wilderness Health Night. We have a plastering event coming up as well. We have a welcome night we're planning on having at the TAV in the next couple of weeks. So the other big advantage in our club with the federal funding means that most of our events are like $5, $10, so they're pretty cheap. They're a lot of fun, and you get to do things outside of your discipline, which is really cool. So, yeah.
I've just got one more question for you. We've got a lot of international students in the room. Yes. So what might be an advantage for them to be part of the rural society?
It's definitely a huge advantage. You get to meet people outside of your discipline, which is really cool, getting to meet lots of new people across the university. So we have lots of students studying at the Medical Centre campus and also at the main campus. And it's really nice to hear from other people in different areas of health, because the odds are you're going to end up working with some of those people as well. So it's really nice to get to know what exactly does a speech pathologist do, or how could an OT help my patient, or that kind of thing. Hearing that from a student who's really enthusiastic is really an awesome experience. This year we're also looking at running a really cool night. We're going to do one that's a first 5 minutes in an emergency, so it's a lot of like first aid. If you're in a rural environment and you come across a car accident, what would you do, and things like that. But also more practical stuff, like if you go on a rural placement and you get a flat tyre, how do you change it? Because there's no one around for like a couple of 100 kilometres, and a lot of our students, and particularly international students, haven't been somewhere where there's no one for hundreds of kilometres, and you'd be sitting there for a long time waiting for someone to change your tyre. So we're looking at doing a few different things like that that are probably more specifically related to international students as well. And yeah, just come and join us. We're a lot of fun.
Thank you. Thanks, Kirsty. Okay, you're up again, Pauline, now. So this is not Katrina Brereton, as you can see. But I'm going to hand you over to Pauline.
I might take that one.
Okay, well, that one's been doing longer, so that one's been doing longer.
Okay. Hi, everyone. Yes, I'm clearly not Katrina. This section really is to talk to you about getting organised, managing your study, your time, thinking about all of the things that you'll need to organise, and who do you talk to if you need some clarification around things that you need to do, when your assignments are due, all of those sorts of things. So all of you in a classroom will have a person who is your tutor. Now, they may be officially a lecturer or a senior lecturer or an associate professor or whatever, but basically we'll refer to that person who is in your classroom as a tutor. And that person might be permanently on staff, or they might be a casual member of our staff. They may also teach across lots of different topics, so they won't only teach the topic that they're teaching you. So whenever you need to email them or contact them, you need to be really clear about who you are, what class and topic you're in with them, and then your question. So they know and they can narrow down that question. Because if you say, I'm not sure about assignment 1, can you help me? And that's the only information in your email, they're not going to be able to help you, because they don't know what topic you're talking about, therefore they don't know which assignment 1 you're talking about. So please be clear. If you use your student ID number within your messaging as well, a lot of students put it as part of their signature on their emails, which is really helpful. It means that we can look you up really quickly. We can look up things like your study plan, if you need to change a class or something. So I got an email this morning from a student saying that something's happened, they're not able to come to class, can they come to something else? They've got their ID number there, great. I can look up their program, I can see when they're available, and I can suggest a class. So things like that really help us to answer your question in a timely manner. Okay, so always be really clear in your communication. If for some reason you can't get hold of your tutor, you forgot your tutor's name because you only just met them and you've met 10 people this week and you can't remember, have a look on the Flow topic page. So Flow, if you haven't figured out, stands for Flinders Learning Online. Flow is not a person, it's a thing. Don't ring up and say, can I speak to Flo? Okay, Flo can't answer that phone call. We do have that sometimes. So you can go on there and have a look at the email information for your topic coordinator. But something we've initiated this year to try and make it a little bit easier for students is every topic has an email address specific for the topic. So if you think it might have been Pauline or it might have been Deb, but oh, hang on, is it Leanne? You're not sure, but you know that you want to ask a question about Nurse 1001, you can email nurse1001@flinders.edu.au and the topic coordinator will get that email. Okay, so that we've tried to make that a little bit simpler for people so that they don't get mixed up about how to get hold of their topic coordinator. So hopefully that will help you. So the topic coordinator should be able to answer your questions if you can't remember your tutor's name or can't find them or you haven't had a response. Just to let you know, the university policy is that we have 3 days, business days, to answer your emails. Okay, now we all try to get back to you much quicker than that, but there will be peaks and troughs in workload for us and busyness for you as well. So sometimes something will be urgent for you, but it might also be a really busy time for us where we're getting an enormous number of emails. So if you can be organised, plan ahead, think ahead, questions you might have, don't leave them till the last minute. So that means if you're doing your assignments in advance and not at the last minute. So I'm probably not going to answer your email at 1 a.m. that says, I can't remember what I'm supposed to do in this section of the assignment. Hopefully I'll be asleep and not answering it. So hopefully you'll have asked that question the week before the assignment's due, at least, not the night before it's due. Okay? So think about how you communicate with people. We have a site on, or a tab I should say, on all of your Flow sites called the BN Course Information, and there's a lot of information there about these things, so it's readily accessible at all times for you, but also it gives you a communication framework, so it explains if you've got a question about a particular thing, who you should make contact with. Now, if you're in doubt about any of those things, you can always email the college office, which is nhsinquiries@flinders.edu.au, and they can triage your email to the right person. Okay, so that's like a last resort, not a first resort. We need you to understand the system and to try and utilise that system effectively. When you do that, it works really well. So the more you can do that, the better the service will be that you get as well, because things will be really efficient. Okay, so that's going to be really important. Danelle mentioned to you about some of the support services, and she's a really good triage person for you to make sure you're accessing all of the services that you may need or that you could utilise, so that's really important. We are a team. We do all talk with each other. We make sure if someone's got a student in a class that is having difficulties, if we know other topics that you're studying, we might just say, you know, has this student checked in with you? They're having a few issues. You might want to just check in with them and make sure they're okay, that sort of thing. So we do check in on you. So if you're having issues, let us know. Don't just not turn up at class, because if you don't turn up at class, we start to worry. And we sort of think, oh, I hope they're okay. I hope it wasn't just they didn't want to come to class today. So you might get emails from us to just go, you okay? Anything going on that we need to know about or you need some help with? And if that happens, you know, consistently, then we start to send more emails and we start to really send people to follow up. And so if you just don't want to hear from us that often, just tell us, like, you're okay? Something's happened, you didn't come to class or whatever, you know. Couldn't get there today, kids were sick, whatever. So just always let us know, and that way then we don't have to worry that, you know, something awful's happened and we need to go knock on your door and make sure you're okay. All right? Really important. For many of you, university life might be new, or at least new in this university. So it might be a little bit different to other experiences you've had at school, colleges, TAFE, universities, in other places. So please read everything thoroughly to the end, all right? Not just the bit you can see on the phone without scrolling, all right? Scroll. I know we especially at this end of the year, we do write quite long messages because we're trying to make sure you know everything you need to know. So lots of scrolling. They'll get better. They'll get shorter, I promise. Well, I hope I can promise that anyway. I'm aiming to promise that. But yes, make sure you read thoroughly, okay? All of the information is important, not just the first sentence. So really important to make sure you read all the way through. Now, some of you will be full-time, some of you might be part-time, so that will change your load and requirements. But one of the key things that you need to think about is how much time have you got in a week to do all the things you need to do, including your study. So some of you will have had very busy lives and now you're adding to that busy life. Are you taking something out of that busy life to replace with the study? Or are you just adding study on top of that already busy life? Adding, that's what I was worried about. Let me just find this. I want you to imagine for a minute, well, not really imagine, have a look. It's on the screen, you don't need to imagine. This idea of a week. Ideally, you should at least be having breakfast, lunch and dinner. Now, there's other things you have to do in a week, right? Think about all the things in your life that you have to do in a week. Remember, you've now taken on the commitment to be a student and to study. So you've got to come to classes, you've got to do assignments, you have to prepare for those classes. You've got to travel to and from them. For some of you, that might be quite a distance. Might take quite a bit of your day to do that. So think about how can you use that time wisely. So if you're using public transport, there's Wi-Fi. Can you be reading things while you're on the public transport? I used to catch a bus to work and sometimes do the marking until people used to be looking over my shoulder, so I thought that wasn't such a good idea anymore. Had to stop doing that. But think about how you can use every minute of your day effectively. What you'll see on a lot of your flow sites, there'll be an activity or something to read, and a lot of the time we'll have in brackets next to it approximately how long that activity might take. Now, one of the reasons we do that is so that sometimes you only have 20 minutes. So you can have a quick scan and think, is there something I can do in that 20 minutes? Rather than think you have to, because it might say all of the preparation activities add up to 2.5 hours, and you think, I haven't got 2.5 hours. But you might have 30 minutes here and 40 minutes there and 20 minutes here. So you can break it up and do it in bits and pieces. Okay, so it's about thinking creatively with your week, thinking how you can fit things in, and really looking at each of the modules and each of the activities you have to do, planning ahead, thinking where and how can I fit them into my week. Now, a really important question. Who in this room knows that they are a procrastinator? Now, some of you might be thinking, I'm not sure. So who in this room puts off the things they have to do because they don't really like them and they don't really want to do them? And suddenly things that you thought you didn't like become really interesting, like doing the dishes, cleaning the bathrooms. Suddenly they're much more exciting than writing an assignment. Who's in this category? Hands up high. Yeah, I am too, actually. My husband always says to me, oh, you're cleaning, what is it you don't want to do? He knows that's the sign there's something I don't want to do. The best advice I can give you is, whatever it is, just do it, all right? Not that I'm sponsored by Nike, but just do it. It's really hard. Don't think about it, right? The more you think about it, the more you turn yourself off doing it, or you think of reasons why. But I could just do that later, because then I'll have more time and I'll feel rested, and I really probably should contact my friend now, because I haven't spoken to them for months. You know, another couple of hours isn't going to matter, is it? Do a couple of hours on your assignment, and then the reward is you get to catch up with your friend. All right, you're going to have to change the way you think about these things. You're going to have to prioritise your study. Otherwise, you're going to get to know Deb and I really well. And whilst we would love to get to know you, we don't want to get to know you for those reasons, okay? We don't want to meet you because you're unsuccessful with your study and you're struggling and you're failing, okay? That's not the reason we want to see you. We want to see you walking down the corridors going, I did it. I just did it. So you're going to have to get that real mindset, positive, encouraging, and do it. Now, looking at this table, think about all the things you've got to fit in. Have you got an idea how you're going to fit all this in? Could you plot that on that table, and are you going to be able to fit everything in? Can you imagine it? All right, I'm going to show you an example. Let's see if yours looks anything like this. Did anybody forget to think about when they're going to sleep? Yeah. Think about what time do you normally get up, what time do you normally go to bed? You know, those hours might adjust for you, of course. This is just an example. You'll see there's a couple of days where dinner or lunch or breakfast might get missed. Very important though, could you please shower every day? Okay, prioritise that. Get really quick at it. Think about, we're in drought, I can't waste water. That'll make you quicker in the shower, okay? So that's a good idea. We should all be saving water. I was going to say shower with a friend, but I'm not sure if I should promote that. Oh yeah, COVID, good point. Yeah, but you're cleaning, does that, I don't know, does that work? Is that counterintuitive? Sorry. We get a bit silly sometimes. Think about how much study you need to do each week for your classes in preparation, for your assignments, okay, so that you do something each week, so you don't have that big last minute mad panic trying to get it done, can't find the resources, computer broke down, there's been a power failure, you're not going to get it in on time, okay? You don't want to be that person in crisis under stress. You're not going to do your best work, then you're going to be disappointed with yourself because you didn't get the grade that you wanted to get. Okay, so planning, planning, planning. However, there's a few things missing off here. Can anyone think about things that might be missing off of there? Maybe commitments you've got yourself that might be missing. Yeah, so we've got meals in there, but how are you getting that food? You know, Uber's good, but it's kind of expensive. So maybe you've got to make things. 2-minute noodles are good, not healthy if you have them all the time, but they do save time. When in doubt, add a can of tuna. Oh, so you think that you want to see your family more often? Yeah, that's the problem, isn't it? So, whoops, forgot the kids. What about the aged parents you might have to provide some care for? Shopping, might be for pleasure or for food, something essential. Hair appointments, well, you know, for some people they're very important. They do happen often. Medical appointments, you may need to have regular medical appointments, so that's going to be important. So think about all of the things that you do in your life, not just the obvious kind of, you know, eating, drinking, sleeping, going to school, going to your job and going to uni. There's a lot more to it. So it's a really good idea to think about that. Keep a diary, keep a calendar, plot it out, work your way back from assignment due dates. Think about how much time you might need to do to research, prepare, start writing those assignments. Okay, so plot backwards so that you make sure you've got enough time. And you might need to exchange things, of course. Things happen, birthdays, family celebrations that you don't want to miss out on. And it may be scheduled at a time when you were planning, of course, to do your study for something. So maybe do an hour's study and arrive a little late, if that's appropriate. Maybe swap something else you were going to do. I don't recommend you swap out, physical activity. So keeping yourself physically active and healthy is going to be really important for you. So if you can keep yourself healthy and well, you're going to be able to study and learn better. Okay? Then you'll be more efficient in your learning. Otherwise, if you're chronically tired and unwell, you're not going to be able to study effectively either. So think about all of the things that you can do to keep yourself healthy and keep yourself well. Okay? And then you're going to be much more efficient. A key thing, you may have seen this slide already, I'm not sure, but a key thing is, whilst we start this year for you in March, from now on we run the whole of the year. Okay? So no weddings, no holidays, no babies. Oh, good. We know that's not always possible. You do get breaks in the year, okay, but you may not know definitely when they're going to be until you get quite close to them. Okay, so last minute holiday deals, if we're allowed to do that again, will be your best friend in the future, because we want to make sure your study program is the best it can be and you get the best opportunities for placements and things like that. And sometimes they are cancelled and they have to change or get moved because something's happened with one of our industry partners. Last year was a prime example of that. But, sometimes there might be an outbreak at a aged care facility and they just can't have students at the moment, so things might have to change. So we need you to be a little bit flexible around that, and we don't want people losing and wasting money because they've booked a holiday and those sorts of things. Okay, so if you can hold off on those things predominantly, that would be good. That'll make your life easier and our life easier as well. So those of you who recognised you're a procrastinator, has anyone thought of a strategy other than just the Nike idea of how you're going to overcome this? Anyone got any strategies that have worked for them in the past that you'd like to share? No, that's why you're still calling yourself a procrastinator, isn't it? Jessie's got one. Let's see what strategy Jessie's got for us.
When I'm studying, and when I did my undergrad, and I've done many degrees, I start doing one topic, one assignment, and when I start going, I can't do this, I'm so bored, I move to another topic or assignment or work. So you're kind of allowing yourself to change and think of different things and not get too bored, and sometimes it just gets a bit too much. You go, don't get upset, just move to the next part of work that I need to do. So that always works for me.
Yeah, thanks, Jessie. I think that boredom notion is often a problem for people who are procrastinators. They want to do something different. They want to be kind of entertained by their activity all the time. And so chopping and changing rather than just stopping and doing nothing can be really important, for sure, to do that. And I think, having a list of things and break things down into small bite-sized activities so you can tick it off, so you feel that sense of achievement that you've done something. All right? Often that is the motivation to keep you going. So have a good place to study. Make sure you've got a nice area or space. If you're studying on the kitchen table, you're going to have to clear away, every time somebody wants to eat. So that's not always ideal, because once you pack those books away, getting them unpacked and open again can be a bit difficult, can't it? Sitting on the couch while you've got Netflix running on the TV is probably not ideal. So think about, separate the time, separate the location, set yourself up, be comfortable. If you are going to be sitting at desks and things for a long period of time, you've got to get up, you've got to move, you've got to stretch. Okay, all of these things are going to be really, really important. All right, every minute counts. Now, normally Katrina, who is a palliative care nurse, would talk to you about some of her experiences because she looks after people at the end stage of life. And she has now become much more conscious of every minute of every day and using it wisely. As you get older, this becomes a bit more of an issue for us. We recognise that perhaps we may have wasted some time earlier in our lives and we might want to not do that anymore. So, you know, from those of us who have been here a little longer than some of you, we would recommend that you don't waste your time, that you use it wisely, and that you make the most of every opportunity that you have. So I hope you do that. Good luck, best wishes, and just ask for help if you're not sure. Okay? Thanks, guys.
I think we're near the end. Yay! Okay, so I think Pauline's really gone through all this. You know, don't fall behind. Make sure you are eating well, sleeping well, exercising. Talk to us and talk to your lecturers. We've had that. We've had that. Yay, look at this. Are you getting the take-home message? Stay healthy. Your brain cells are not going to work. Your cognitive processes are not going to function unless you yourself are well. That means eating well, sleeping well, making sure you have some sort of movement in your life, and make good choices. One of the common phrases I say to students is, you're an adult. You're not a school child. You're not in high school. You know that your assignment was due at this time. You know that your pre-placement compliance was due at this time. Coming to me after the event isn't actually any good now. You know this beforehand. In saying that, we also appreciate life gets in the way. We are nurses, we're compassionate, we are understanding, and therefore we will listen to you. And if there are extenuating circumstances happening in your life, we'll do what we can to try and support you. But it's no good us supporting you after the event. The horse has already bolted. It's down the field and across the river and gone completely. We need you to be there at the beginning, letting us know. All right? So make good choices. Right. So this is it. Whether it's I think only got the 1-3 year, whether it's 2 years, 3 years, you've got lots of energy now you need to invest because this time is going to fly. You're going to have some good fun, you're going to have some stress, you're going to wonder what the heck have I done at times, and you're just going to think, oh my goodness, but all of it will be worth it in the end. When you get that registration through, you know that you can pat yourself on the back and go, hey, I'm actually a professional now, and I can go out there. The world is my oyster, don't they say? Any questions to finish up before we have to go? No? Well, listen, we look forward to seeing you. Any questions here? No? Yeah. Thank you. You've been wonderful. It's good to see some of you so organised, or most of you so organised. That's great from our part. It makes our lives easier. Next week we'll start. You'll get to see at least one there. Oh, maybe not one might see you. And Jessie, you'll get to see next week as well. But in other years that you move through, you'll get to see us, okay? But as Pauline says, you actually don't want to be coming to see me and her. That's not a good thing usually. Okay, see you next week. Bye, guys. Bye. Thank you for